I think the most important questions we ask our doctors about heart health kind of goes back to the most important questions we should ever ask our doctors about anything. I think it's really important for people to understand that what we do in medicine isn't perfect. We are trying to listen to your experience. We're trying to put it together with your family history, if we can get that information. We put it together with lab testing or imaging, but we're trying to essentially build a puzzle to help you and me see, to the best of our ability, what's going on, what the risks look like. And we're trying to look for opportunities to help you improve or mitigate some of those risk factors. We're sort of looking at a map of strengths and vulnerabilities, and we're trying to shore up the vulnerabilities so that we can help you avoid having any of the bad outcomes. So in heart disease, I think it's important to ask your doc about that. What do you think are my vulnerabilities? What do you think are the things that are about me as an individual that make it more likely that I would have an early heart attack or stroke? And what can I do about that? And I would especially try to start with, what can I, the patient, do about that? Because it turns out, as much as us in the white coats would like you to continue to believe that we fix you for the things that kill us these days, for heart disease, for metabolic diseases like diabetes and obesity, for neurodegenerative diseases, for those kinds of problems, the things that are killing us and making us suffer, those things are actually best addressed by the lifestyle choices that we as patients make, not the things that doctors do to you. Another layer is, do you think I have significant heart disease already? Do you think I have enough plaque that I could get into trouble and have an event occur? And is it too late? And how do you know? And there's all kinds of testing that can be done depending on where you're at in life and how high the risk appears. But I think asking the question gets everybody thinking about and looking at the possibilities for what could be done. I think that if your doc and you come to the conclusion that you have a fair amount of risk on the table and you have outlined what you could do, you, the patient, could do about that, that's a great time to start asking what your doc can do for you. Are there things that you as the doc can do that I can't do? Are there medications? So whether we think about blood pressure medicines or medicines for diabetes or medicines to help with obesity or medicines to help with cholesterol, that's certainly our job, right? That's the thing we can do that you can't do. But I think the best time to ask that question is after you've understood the other parts and after you've determined what you can do in terms of those other things. I often think about vascular disease. It's a little bit like if you're in a boat and you're driving the boat out into the shipping lanes and it's foggy. We sometimes can't see the risk that's in front of us. We're fortunate because there are tests now that can allow us to see into the future a bit further. We can do laboratory testing that can measure risk in more detail. We can measure inflammatory markers. We can measure proteins on lipids that govern behavior and risk. We can look into the vessels of the heart and see whether disease is present far before it could ever cause you to have an event. It's a little bit like turning the radar on the boat and looking out into the fog. The further away the danger is, the less of a change you have to make in your course to avoid getting hit. So if it's 20 miles away, I can make a small course correction and we miss. If we don't know until we're 100 feet away, then I have to turn the boat hard. And so, if you find out that you have a significant amount of plaque and your blood pressure is very high and we're very close to danger, you may need your doc to prescribe drugs and you may need to make a lot of change quickly. If you're younger, if you appear further away from the risk, you may be able to make much less invasive and sort of less pharmacologic change and be able to still avoid having things happen. So I think asking, what do you see as my risk? What do you see as my risk factors? What do you see that I can do about it? And then asking, what do you need to do as the doc? I think those are the ways I would approach asking my doc about heart disease.